officially live, and I want to welcome everyone who is tuning in to Leadership Lynchburg's call on mental illness, self-care, and addiction during this time. And these are hard topics in everyday life, but even during something like COVID and with the events that have happened nationally over the past couple weeks, it's even more important to talk about this. And so we are privileged today to have with us some great friends of Leadership Lynchburg, some distinguished alumni, and some new friends of this community, and certainly a community of expertise with these subjects. So I'm going to briefly do some introductions, and then Nathan, our esteemed panelist facilitator today, is going to take over. Nathan Roberts is an alumnus of our program, Leadership Lynchburg flagship program from last year, LL44. He is also in the process of getting his master's as a licensed professional counselor, and this subject is near and dear to his heart. And then we also have my longtime friend and Leadership Lynchburg alumnus, Rhonda Turner. Rhonda is a published author, and she is the clinical coordinator for outpatient services at Horizon Behavioral Health, but she's also a founding member of the Central Virginia Addiction and Recovery Resources Group, which she's going to tell you all about. And then Katelynn Jones is a licensed professional counselor, and she works for Hope for Tomorrow Counseling, which is part of Patrick Henry Family Services. And then we have Dr. Dhat, who I am just met for the first time via Zoom. I guess it was 2 weeks ago, Dr. Dhat, and we had a great conversation. He is the psychiatric medical director of Pathways Addiction and Recovery Services. So welcome, you all. And as we were talking before we went live, we want this to be, we want to give space to wherever this conversation goes. If you are watching and you have questions, please put them in the chat. We will monitor those, and we will make sure that we address your questions. As I mentioned before we started, there have been days I have not been okay with all of this. Yesterday was one of those days, and we want to normalize and make it okay for you to raise the white flag and say, I'm not okay. I'm not okay with what's happening in our society right now. Or we want you to be able to recognize and give space to those you may be working with or that are in your family that may not be okay. And so that's kind of why we're here today. And so Nathan, I'm going to turn it over to you to start our facilitation process.
Wonderful. Good morning, Christine, and this panel. I am so excited to be doing this conversation with you guys. Happy Thursday to everyone. Christine and Lynchburg Business Alliance and Leadership Lynchburg, thank you for recognizing this need and giving time to this topic, this conversation. I am grateful, personally grateful, because I know this topic is going to touch someone somehow, some way, and we all have been affected to a degree by mental health, by addictions, and by suicide in some form or fashion. And so this conversation is definitely needed. So thank you to you guys over there. I really am grateful for that. I work for the Department of Aging and Rehabilitative Services as a placement counselor there, and I'm honored to do this work. And I get to tap into some of the resources that these people do every day. So without further ado, let's get this conversation started. Rhonda, what a pleasure meeting you today. Rhonda with the Central Virginia Addiction and Recovery Resources. So Rhonda, tell us a little bit about who you are as a person personally and a little bit about CVARR, please.
Well, first of all, thank you, Christine, and thank you, Nathan, for having CVAR to be represented on this panel. I am, as Christine stated before, I work for Horizon Behavioral Health. I'm a clinical coordinator. I work in addiction services. I've worked for them for 26 years, over 26 years in the field, from everything from detox to outpatient to residential and even crisis stabilization. So I've worked on the continuum of services for Horizon. I will say before I get into CVAR, Horizon Behavioral Health was instrumental in helping to form CBAR. CBAR is the Central Virginia Addiction and Recovery Resources, and it is a standalone coalition, meaning although Horizon helped us to get started and we have other organizations, we have representation from 12 sectors of our community, and that would include youth, law enforcement, churches, civic groups, volunteer groups, organizations that work with substance use and addiction and mental health. We have parents, we have businesses, we have those 12 sectors covered on CBAR. And again, CBAR's mission, basically, there was 3 groups, 3 coalitions in the community prior to the CBAR forming, and they were all doing some great work. But we felt like we could be stronger if we merged together, and that would keep us from reduplicating services and save some funds. And what we also found out is a lot of the people on the coalition were on several coalitions. So we merged, we came together to form CBAR, and CBAR was formed, and we are excited that we officially launched earlier this year before pre-COVID. We launched, and we've been doing some great things even prior to the launch. So CBAR meets monthly, and it meets the first Tuesday of every month, and we meet at Lynchburg Health Department. We have 3 focus groups that we focus on. Well, actually 4 focus groups, and that is prevention, recovery, treatment, and a provider's work group. Those are the 4 work groups that we do our work in. I just want to also say that CBAR, we have a strategic planner, and her name is January Davis, who was very much instrumental in using resources given to her through Horizon Behavioral Health to start the coalition. Our chair is Melissa Rolfe, and she works for Community Access Network. She is our coalition chair. And we are just excited. We have a leadership team, and I'll explain them as I go on, because our leadership team consists of each work group. The chair of each work group is on our leadership team. And again, we are a working coalition. We are not a name-only coalition. We hit the ground running. And one of the things, again, CBAR's mission is to reduce substance use in our community and raise awareness. That's what we are about, is getting the word out there. And so our 3 groups, the prevention, Christy Meeks is the chair of that. And we are excited because that prevention group, it is working on the drug-free community grant. And you may have heard about that. We were the only one in Virginia, the only community in Virginia to be awarded the drug-free community grant.
Wow.
And so, yeah, that's exciting.
Yeah.
And we are looking at youth, underage drinking and drug use. And so we have initiatives around that. We, again, are working with law enforcement, the schools, and the community to address that issue. And so we're doing a lot of education in that area. The recovery group is headed by Jeffrey Fulmer and Carl Mack. They co-facilitate, co-chair that group. And they're looking at reducing the stigma of addiction in the community. We all know that there's a stigma with addiction and people getting help. And there are a lot of barriers to that. And so this group is working on a really unique opportunity, which is called the Recovery Cafe in our community, trying to get that established, which would be a place for individuals in recovery to come and just hang out and to feel supported. And we want to get that going, and they're in the process of making that happen for the community here in Lynchburg.
Why is that important, Rhonda, that someone who is working through some substance use disorder, why is that important to have community wrapped around them?
One of the things we often say is that addiction is not the absence of sobriety. It's the human connection. The opposite of addiction is human connection. That's one of the things that we say. It's just not enough to stop using, and that's good, but we need that person to be, that individual to be connected with resources, with people, a recovery supportive environment. That's what helps people to succeed. That's what helps people to stay drug-free.
Yeah.
And so it's important to wrap those. And sometimes individuals have burnt bridges with their families, because addiction, they've been caught up in addiction, and they may have done some things that, were pretty hard things to do. And so they need to go and be surrounded by people who support them. And that's kind of like the idea of the Recovery Cafe.
So we've got it. Oh, sorry.
Go ahead.
So we've got a person on the call, perhaps, who is dealing with a substance use addiction. The first step is to recognize you have a problem. What would you encourage the second step to be?
Okay. So recognizing you have a problem and then taking action. And so we recognize that individuals may be in different stages of change with that. And some people are in denial, but once they recognize that they have a problem, they're contemplating, well, okay, what am I going to do? And so they need to prepare and to take some steps. And so we would encourage them to reach out and to get treatment. And this is a good thing. I'm so glad you said this, because this is what CBAR is about. It is difficult sometimes to navigate the systems of getting treatment.
Yes.
Who accepts Medicaid? Who accepts my insurance? Who takes youth? Who takes adults? And so CBAR has worked tirelessly, and we're so proud of this, is a directory, a resource directory, where you can go on our website, which is cbar.org, CBARR.org, and you can put in what you're searching for. You can search for, if you got a youth, and what are you searching for? Peer support, family support. Are you searching for inpatient treatment, outpatient, detox, transitional housing?
Wow.
You can put that in on our website. It's the best kept secret in Lynchburg, I'm here to tell you. You can search that, and it makes the guesswork easy. Can you imagine? I got an individual here, and maybe it's an adult, maybe it's an elderly adult. And I said, oh my goodness, what's out there for a senior who has Medicare? Yeah. I can go to the website and I can put that in. I can search it and filter it and come up with the facilities or the organizations in our community that will serve this individual. How neat is that? So you may ask, what have CBAR been doing during COVID? We've been keeping that thing updated so that it could be a tool to be used in our community.
Rhonda, you make me want to clap. Go CBAR. That's beautiful.
Yeah, and Rhonda, I have put the website in the chat area, and I will also post in the Leadership Lynchburg group so people have that resource.
Rhonda, I know that you have many success stories, even just starting probably in January, but just take a couple minutes to maybe tell us a success story of somebody coming through the process, recognizing they need help, taking action to that, and then connecting in with CBAR and you all, and a success out of that.
So one of the things about CBAR is that we do support the recovery community. And recently we had an individual who had been through treatment, and she had, and now she is a member of our CBAR, and she's empowered to tell her story. And so CBAR is a place where if you're in recovery, and we have plenty of individuals who are members of CBAR who are in recovery, but it's a place where you can tell your story. So we know that you can put a face to addiction. You can come there and talk about it, be supported, and make a difference in your community. So we are really excited that we have a young lady who went through treatment and is now connected with us and preparing to do the work of CBAR. So for us, that's one. We have many success stories, but to me, that is a big one. That I worked the program, and now I'm sitting at the table making a difference in my community. And I just want to add, Nathan, if you will, we have some other groups besides the prevention and the recovery group. We have a treatment group. And I certainly would be remiss if I didn't talk about the treatment group, because I chair that group. And guess what? Dr. Dhat is a member of that group as well. He's a member of CBAR. So it's great having him on as well. And so what we're working on in the treatment group is looking at where are the gaps in services. Where are, we think we know that there's a gap, there's a need for detox treatment. You know, we have some detox treatment, and Dr. Dhat, I'm not gonna steal your thunder because I know you're gonna talk about that, but we know we need more. And so we're in the process of creating a provider survey to look at the needs of our community, what the providers see as the needs of our community. Is it transitional housing? Is it, do we need men's transitional housing? We have some recovery houses, we have Oxford houses, but what do we need in our community? And so we're excited about that. We're also excited about working on putting something in the hands of newly released individuals. And sometimes they get information, and that's a lot of information out there for them.
Released from incarceration?
Yes.
Okay, just wanted to make sure that was clear.
Recently released from incarceration.
Yes.
There's a lot of information out there.
Yeah.
However, we want to give them something that won't overwhelm them. And so we're working on that, and that will be coming out too. CBAR is working on a lot during this time. And one of the things under the drug-free convention, you may be seeing this on Facebook, is having youth, the Get Hype group. We've been promoting that, where it gives youth the opportunity to come together. They have music, they have prizes and giveaways and all this wonderful stuff. But most of all, they have education on substance use. So they're raising the awareness, but also drawing them into things that they like, you know, the TikTok videos and the music, and bringing them in so that they can win prizes on answering things related to substance use. So during COVID, that's some of the things that we've been working on. And we're very proud of the progress that we have made.
That's beautiful. It's almost like it's okay to talk about substance use, but let's do life together. And in the meantime, let's talk about this addiction or this substance use, right?
Exactly.
That's
that's what we want to do, because no family escapes substance abuse or addiction. Right. No family. Right. That I know of. You know, it may not be your immediate family, but it may be your extended family. And every now and then someone will run and need to know what happens, what do we do? And we need to normalize it, because people have not talked about addiction. It's been quiet, it's been taboo, and we need to talk about it. Just like mental health issues, it's the same thing, all of it. No one wants to talk about it, but guess what? We're seeing an increase and a rise, and we have to start talking about it.
Yes.
Not only do we have to start talking about it, but we also have to start advocating and talking to our legislation about laws and things and funding to support these services, because we need them. Pre-COVID, we needed services, we needed funding. So you know we need them after COVID.
Girl,
so,
I think you are the person to get that advocation on. Is that even how you say it? Advocation? You've got the passion and the drive, Rhonda. I'm so grateful to have met you today. Yes. And thank you for sharing about that.
Thank you.
Sounds like you guys are doing some great things, and I look forward to even connecting in more so that we can utilize you in our office. Mm-hmm. But Rhonda, thank you so much for your time and your passion. I really appreciate that. Dr. Dhat, it's so nice to meet you today. Also, thank you for what you're doing in the community. If you'll just make sure you unmute yourself, but you are from the Pathways Treatment Center in Lynchburg. And so I wanted you to tell us a little bit about yourself and tell us a little bit about Pathways as well, please.
Perfect. First of all, thank you, Nathan, and thank you, Katelynn, for arranging this panel and addressing this very important topic as we are discussing, and very real topic. About myself, I was born and raised in India. I did part of my medical schooling back there, and then we moved to States in 2009. And after that, I always had a zeal for mental health and substance use, and mainly after I lost my friend to overdose with opiate, I decided to get into the psych residency. I finished my psych residency from Southern Illinois University, and I did my fellowship with American Society of Addiction Medicine, and I've been serving Lynchburg population for the last 4 years or so with Centra as a medical director for addiction services. I'm glad you said pathways, because with the increase in need with substance use and in our community, Centra is increasing the services, and we are growing. So it's not just limited to pathways now. Definitely pathway is a big part. So pathway has 15-bedded beautiful inpatient facility in Amherst, where we provide inpatient rehab, and we have intensive outpatient rehab at Virginia Baptist Hospital, which is a step down. And then we do have the detox treatment at Virginia Baptist Hospital through the pathways. So when I said we are growing, we added the addiction treatment center last year, which is the mainly medication assisted treatment for opioid use disorder in the form of Suboxone and the naltrexone, and which was really a need of the time for our population and community. And we have been serving more than 60 or 70 patients so far, and that's a huge success. So I'm glad to be here, and I'm glad to be part of Centra. And thank you for inviting Centra.
It's sort of a small world because oh, Christine, you're muted.
That's okay. I was gonna, I can't stay quiet. So Nathan,
yeah, no, keep it unmuted, girl.
I'm just. Dr. Dhat, as you were talking, I was thinking about, okay, you have all these entry points, right, for if someone needs help. What if I'm sitting here and I'm like, I'm not okay, but you don't know where you might want to go or what's your first step? And I know part of it is a diagnosis or some sort of, but if I'm sitting here and I'm not okay, or I think I have a family member or a friend that's not okay, what's my first step?
Sure, and that's a good question. Lot of people are in that state, and so the first step is opening up and talking with somebody. So talking with your provider, and that's what Rhonda and we are working at CVAR or everywhere, like wherever I can get a chance to work on the stigma associated with the addiction. Like we think that addiction is something about the weak character, or it is just that you are seeking the drugs. It's clinically proven that addiction is not just about the character, but it is a disease, and it is because of the brain circulatory changes. So definitely when you feel that you or your loved one need help, approach your provider. And we at the Centra had a common phone line that is 434-200-4455. And that used to be a Pathways phone number, but now we did the phone line for whole addiction services, where you will get the option that what service you need. If you need to go to the intensive inpatient rehab, or you need to go to the outpatient rehab, or you need something with the opioid use disorder in addiction treatment center. And if you need more help, feel free to text me anytime. I'm here.
Yeah, I just put that number in the chat box for those that are watching, and I will also put it online. So thank you for answering that question, because again, it's all about just raising that white flag and saying, I may need to talk to someone.
Yeah,
for
that's
sure.
One of the things that you said in your introduction, Doctor, was that you lost a friend to addiction. So that kind of actually, it's interesting how personal contacts sometimes end up putting us in the profession and the career that we're in. So thank you for saying yes. Sorry for the experience of that friend of yours, but it's amazing how you're being used today because of that situation. So for some of the leaders that are in our community or employers, they may have an associate or something that is a functional alcoholic or substance use user. What should we know? How can we spot this, what can we do from a workforce perspective to help with the wellness and help encourage somebody towards healing in the right direction?
Wow, that's a big question, Nathan. All right, so let me answer it in parts. So when you ask me about the functional alcoholic, so generally the stereotype about the alcoholic is somebody who hit the rock bottom, or who is like homeless, who does not have anything, who lost everything. But most of the alcoholic who I do see as a patient are not there. And the functional alcoholic, which is the term used, which is although not a medical term, but commonly used, are the people who can drink more and more amount, but still can be functional in community, in society. They can still hold a job and does not appear to be hitting the rock bottom or something like that. So for these people, the most difficult part is to recognize the warning sign. So for the loved ones or for the associates, how to see if or how to recognize this warning sign is they are commonly described as somebody who hit the bar first thing immediately after finishing the work, or somebody who is still drinking as if they are in the school or in the college, like as if they never graduate from that stage, or somebody who can't tolerate the drinks way more than somebody of that age or that particular stage. So these people are obsessing about the drinking, like they're always thinking about the next drink, when and where they will have the next drink. They will be cracking jokes about the drink. So that's how you can think about red flag. Oh my God, he's always talking about the drinking. There's something wrong, and that's how you can approach him or confront him if your loved ones. That's the first stage. And as I said, they are in denial, so they will never accept that they are drinking more. They will always come up with the reason that, oh, I drink only the expensive wine, or I drink only when I'm stressed, or something like that. So the commonly sometimes what works is traditional intervention, family intervention, coming together and telling, hey, we are seeing this, we need to work on this. Or, as I was telling Christine, that getting the patient to the provider and letting them work on the motivational interviewing. Katelynn might be talking more about that, but that is something we can bring them to the reality that, hey, alcohol is a problem for you. Because most of the time, by the time the functional alcoholic get to the realization, is too late, because they either get DUI or have some liver problems or something like that. So we need to catch that before that happens. The next part, you asked about the wellness. So wellness is defined as the active state, like active pursuit. It is not a passive state, meaning it is a state of complete physical, emotional, and social well-being. So that you cannot just say, hey, I'm working on wellness. You need to be actively working on your wellness. And so there are a few small tips in this stressful environment for the wellness, which I would give to my associates, and we are working at Centra, is definitely we are going through this pandemic, and which is unprecedented, and we never thought about this. We are not we're not used to wear the mask all the time. This is something new for everybody. So this is obvious to be anxious or a little frustrated in this environment, right? So just to be cognizant of your emotions and feelings and that helps when you're cognizant of your feeling. Also, it is helpful to address those feelings if you are aware of your feeling. The second thing is that take care of your own body, like eating healthy, doing some exercise, sleeping on time, and being more compassionate towards each other, because everybody is stressed in this environment right now. So just being more understanding of each other. And last but not least, reach out. Reach out to your friends, your family, via phone, FaceTime. Social distancing does not mean social isolation. You need to be in touch with each other, and that is a very important part of the well-being.
Doctor, can you say that one more time, please? I think that's so important.
Yeah.
It's social distancing does not mean social isolation.
Yes.
And I definitely insist on that. I always tell my patient that you need to stay in touch with your family, friends, loved ones, because it is very important. We are human beings. We are social creatures. We are not meant to be by ourselves.
That is so good. So just to wrap up our time with you, Doctor, is that self-care, we understand in our field how important that is. We read about it, we study it, we're taught it. But for someone who may not know all about that, for you specifically, what does that look like for you as being a man, a family man, an employer, a leader? Talk to me a little bit about that.
That's a great question. So yes, we as a provider, we all struggle with keeping the boundaries between our personal life and work life. I find myself thinking about my patients sometime at home as well, and this is common. This is not something unusual. But I remember one thing. We all travel through air, and I'm sure we all ignore the briefing that the air hostess gives. That if in case of emergency, we need to wear the oxygen mask first before we can help the child or somebody else, right? And otherwise it will be too late to help child, and we both might die because of unconsciousness. So that is very, very important. That stuck to my mind when I heard that, because if I'm not taking care of myself, I cannot be of any help to anybody else. And so I try to remind myself of that metaphor always. So when I go home, I try to finish all the work at my office, and then I go to home, and then I can be at home, my family, and something. I enjoy the meditation. I enjoy again, as I said, just be in touch with my own feelings, and that helps. Some exercise. I wish I could do more exercise, but whatever time I get, I do try to do some exercise. And last but not least, I enjoy playing Xbox with my son, who is 5-year-old. So, and that's my oxygen. So definitely. So that's how I keep up with my well-being. And I would advise the same to you all, that you need to have your own oxygen to help others.
I absolutely love that. And little did I know that we kind of work next door to each other. I'm privileged to work part-time at Centra for the psychiatric unit as a mental health professional. Cool. And so one of my biggest go-to phrases is work on this time to get healthy so that you can provide health to other people. And that's across the board for no matter what position we are. I've got to be healthy in order to provide any ounce of health to someone else. And health looks like different things, support, health. You get what I'm saying?
Very, very true, very true. And that's what I always use that oxygen metaphor there, because that is very, very important, very important. And especially with this whole crisis that we're going through, this is very unprecedented, and we need to take care of ourselves, and we need to take care of each other, because that is very important.
I love that, doctor. Thank you. I almost want like a mask to fall down right now. Taking a deep breath.
That's funny.
But I love it. And I've heard that analogy so many times during this time, but that's life, period. That's life, period. So anyway, thank you so much. What a privilege and honor to have you on here.
Thank you.
Katelynn Jones from Hope for Tomorrow. So glad that you're on here, an LPC representative. We've done lots of work together with different clients that we've referred from DARS to you. So thank you for what you do for our community also. Tell us a little bit about you, what you do, what you got in this profession for, things like that.
Sure. So I'm actually a medical social worker by background. I graduated with my BSW and I worked in the ER, the acute care, the brain injury units, the stroke units, the rehab units, the nursing home units. So I went basically through every level of medical care that a patient could go through. And I loved my time being a social worker. I really did. In the hospitals. I really enjoyed that, but I always knew I wanted to do counseling, one-on-one counseling, and more direct care to be able to follow a patient and not just have them for this window of time. So I did graduate with my master's as an LPC, did my residency at Horizon Behavioral Health, and had a huge range of experience there. Everything that Rhonda just talked about, that all makes good sense to me. I did the intake department, assessing clients right off the street and getting them where they needed to go inside of either Horizon or inside of the community. I worked case management. I did inpatient crisis stay from, suicidal risk to substance abuse. And then I went out to the counties and worked out there for a little while doing therapy, Campbell County, Amherst County, which was very neat, very different, very diverse as well. And then I came back to do more substance abuse. I did the intensive outpatient program. And then I transitioned and I do therapy only now. I know, Rhonda, your wonderful face. I do counseling individually. I do families, a lot of trauma. A lot of anxiety, a lot of self-esteem issues, a lot of childhood issues. And I love it. I'm transitioning, even more into some private practice type roles as well. So there's lots going on, and teletherapy was new for me in the last couple of months, transitioning from my office environment to a tele environment. And I have to say, I was very skeptical of tele. I really wondered if I'm still going to be able to make connections with my clients, if they're still going to get the same level of help. And I ask all of them. I'm very close and very transparent with my clients. And I said, "You're not hurting my feelings. Tell me what you think. Is this working? Is this not working?" And probably 90% have said, "We love it. It's even better. We feel very comfortable. We're able to talk to you." They're not feeling limited or embarrassed if they're having tears, leaving my office or anything of that nature. So they've loved it. And so most of my clients are sticking with the tele, and I'm happy to provide that. So we're doing well by continuing to provide support during this time.
So if somebody on the call is actually looking for some type of counseling services, sometimes, you recognize you need help, but then you don't always know where to go, which is what CBAR is for substance use disorder. So what about for Hope for Tomorrow? Are you guys a good resource for that type of thing?
Yes, I think we are. We have, I can't remember my exact numbers. We probably have about 25 therapists in a variety of counties and areas. So we've got about 12 in between the Bedford and the Lynchburg office. So I supervise those two offices. And then we have offices down in Farmville, Danville, South Boston as well. There are a lot of therapist options in Lynchburg. There really are. You could Google LPC, LMSW, Lynchburg, and you could find a lot. So just as a, little tidbit, my clients I'm very much an advocate of good clinical counseling. And so my clients all know, if you're not getting your needs met with me, we need to get you to somebody else. And that's not an insult. That's not a problem. If I can't meet your needs as your therapist, I need to say something. You need to say something. We need to transfer. So all of my clients go and tell their friends and relatives, shop your therapist, try 1 or 2 or 3 to see if you like the connection, if you're feeling that they're trustworthy, that there's not a judgment. I beg people, please don't just stop at one therapist. If you're not comfortable, please don't think this is the way therapy is and I have to stay with this particular one. Please consider a consult with someone else, consider a call to somebody else. Because so often people get to a therapist who's not clinically sound and they're not going to meet your needs. And then that client does not make progress. And I hate to see that. I hate to see that.
Yeah. So it takes a lot of guts to be able to go and move forward into the counseling and say, I need help, then call, schedule an appointment, but they don't connect. What's your encouragement to encourage them to keep going and not give up on that?
Yeah, my biggest thing is just take a deep breath. There is nothing wrong with you if you're not connecting to that first therapist. There's nothing wrong with you. Every therapist is very, very different. I have therapists that I work with. Some are a little bit more aggressive and a little bit more of a go-getter, and clients love that. They're going to get right into the session and they're going to work, and we're going to get from A to B and we're talking. Yeah. And then other therapists, they're a little bit slower and they're a little bit more gentle and they kind of ease into things a little bit more. And that's fine. That's fine. Every therapist is going to be different. Every style is going to be different. So if that style is not working for you after that first session, please don't go home and say, oh my gosh, there's something wrong with me. They're the mental health expert. They know everything. And I'm probably crazy because I didn't like them. Absolutely not. If they made you feel that there's something wrong with you, we have a red flag. Grab your bag and run out of their office. Do not go back. I tell all my clients, grab your stuff, run, and do not return. There's nothing wrong with you. If it's just not a good connection, not a good fit, that therapist needs to transfer. They need to say something.
That's good. I want to go a little deeper with you, Katelynn, just from the LPC background. I'm going to read this question to you. Mental illness and suicide are on the rise right now in our country. Some states are saying that they're seeing more cases of suicide in the last month that is the equivalent to the last year's rate. What are some signs that we can notice in our family and our employees that indicate a slope or a downshift towards suicide?
Yeah, it's such a challenging question, Nathan. It really is, because so often I hear people asking me, I didn't see the signs, or I missed the signs, or really more often than not, there were no signs. I liked what Dr. Dhat said about those stereotypical signs, the change in demeanor, the not being engaged, perhaps, selling your stuff, canceling appointments. But in my personal experience, Nathan, there weren't signs. I was talking to a woman years ago, and she had gotten very close to suicide several times. And she said to me, Katelynn, there was a huge peace that I had. My brain, my body, I just felt like this was a really good idea, that this was going to solve all my problems. And I was with her in that. I didn't judge her for thinking that way. I didn't, there was nothing wrong with her for thinking that way. The brain had reached a point where, the changes were happening, and that idea it sounded really good. And so I guess I want to answer your question. Yes, sometimes there are those signs. There are the flat affect and the not taking pleasure in things, and, just the, kind of disappearing in terms of the social engagement. But for those people who are survivors of a loved one who has committed suicide, and you're blaming yourself that you missed something, very often there is nothing that you missed. Very often that was their plan, and they may have continued on looking very positive and looking very pleasant and looking very even hopeful, even laughing. And so it's not your fault if you missed it, because there wasn't anything to miss. And so I just want to kind of put that out there for people who are recovering. If you've lost a loved one, I've worked with people who've lost people. I myself, as a therapist, when I lost my first patient to suicide, it drastically affected every part of my life, my personal life, my clinical life. I'm very passionate when I'm in the room with somebody who's contemplating suicide, and I'm very engaged because it is very serious. It's very, very serious, especially when that piece kind of comes and you start thinking, this is a good idea. This is going to solve all the problems. This is going to fix things. And so I want to be able to help somebody who reaches that point in contemplation.
Wow, that's good. Yeah, Dr. Dhat?
I just wanted to add to that, Katelynn, and I totally agree with what she said. When I also lost my first patient to suicide, I was devastated, and it really hurts. And we having a psychiatric background and going through a lot of training, we still end up blaming ourselves. Like, how did I miss that? Why didn't I could catch that? I saw that patient like 2 weeks ago. I could have catched that. But as she said, like sometimes there are no signs, and the patient is so motivated or so fixated on doing something like that. So it is very hard. But yeah, that's very, I'm glad that you shared that.
I want to go a little deeper, Katelynn and Dr. Dhat, as I'm not ignorant to think that somebody on this call or who will be listening to this call is actually thinking of suicide, perhaps has a plan, and perhaps is ready to move forward with that. Can you talk to that person right now?
Yeah, I guess my thought is in being as honest and transparent, if I was talking to you like you were my client, it's not going to work. Ending your life is not going to end things. When your family and your friends, or no family and no friends, the responders or the therapists or the professionals, there is going to be a ripple effect of people who are affected by your passing. A lot of my clients have said to me, but this is going to fix things. It'll make things better for my children or for my family. And some of my clients who have no one, they'll say to me, but it's fine because nobody's going to miss me. Nobody's going to, and I'm like, but you have me. And I'm going to have to wake up tomorrow and I'm going to have to replay our entire work together. And I'm going to have to wonder what I missed. I'm going to have to go through that whole process. And a lot of my clients, they'll kind of stop and they're like, well, we don't want to do that to you. I'm like, no, thank you. I appreciate that. Yes. Let's not do that to somebody who truly, truly cares about you and truly wants to help you. So I think in terms of if you're considering that this is a good idea and that and this is a good plan and this is going to resolve things, I really want you to hear me in so much of a respectful and humbling way. This is not going to work. It's not going to work. There are going to be people very, very negatively affected by that choice. And if you're thinking about that, if you want to call me and speak to me in a confidential way, there's so many ways to reach out to me. If you want to reach out to a crisis line, there are so many ways to do that too. So I don't want anybody sitting there thinking, this is a good idea. This is going to solve all of the problems. This is going to alleviate the burden that people have with me. It's not going to. It truly is not going to, because all those people are going to be in my office tomorrow and they're going to be devastated and they're going to be trying to figure out how to pick up the pieces of their life and move forward. And there's going to be anger and there's going to be angst and anguish and there's going to be so much blame and so much shame. It's not going to work. It's not going to work.
Wow. Dr. Dhat, did you?
Yeah, and like I exactly says a kind of similar thing, that I do care for you, for the patient, and if they don't have anybody else. But on top of that, I also say something that kind of like changed their thinking, is that if you are at the end of the rope, I can provide you some reason to work on. Like we have a lot of voluntary work, such as like we have CVAR, we have a lot of work that you can do for other people who are in the same boat like you. And that kind of like helps them to give little different insight, like, oh, I can do that, right? I can help other people who are struggling with depression or something like that. And that is kind of like a little bit life-changing, like aha moment for a few of my patients, and that worked. So like definitely, as Katelynn said, whatever we can do for these patients, we are more than willing to do. And definitely they can approach us by whatever means possible.
Katelynn, in wrapping up our conversation with you, and then we'll end on a little bit different note, what are some final tips that you can share with those who are listening who may be feeling ashamed about asking for help or needing to be assessed? What can you tell them?
I'm so glad you asked that, because I think the biggest thing, and even Dr. Dhat touched on this too, you having emotions and you having symptoms is 100% normal. Your
Normal.
brain is supposed to give you anxiety. Your brain is supposed to give you sadness. Your brain is supposed to give you apprehension and that butterfly in your stomach, chest tight, sick to your stomach, fear. Your brain is supposed to do those things. The problem that's happening for people is when they're having these emotions, maybe frequently or maybe even out of the blue intermittently, clients panic and their immediate assumption is there's something wrong with me. I need a pill. I need to see a physician and they need to medicate me to make these symptoms go away.
Mm-hmm.
And while that can sometimes be very, very important to consider medication management, people need to kind of take that deep breath of, I'm having these types of symptoms. I wonder why. Maybe I could reach out to a therapist, someone trusted, to sit down and say, okay, here are these symptoms I'm having. What's going on? Why am I having these symptoms? Asking for help is no different than, when I call the doctor because I've got a sinus infection. And I'm like, listen, I'm congested and my nose is running and I've got sinus pain. I need my antibiotic. So I need that prescription. And so seeing a therapist, when you go in, look, I'm having anxiety. I don't want to get out of bed in the morning. I'm dreading going into work. I've got fear when I see what's going on in the news. And if that therapist says, my goodness, there's something wrong with you, like you really need to get it together, grab your stuff and leave the therapist office, call me, call someone else, because that's not appropriate. They need to be sitting down and going, that sounds about right. That sounds absolutely true. We should not be all comfortable during this time. We really shouldn't all be saying, this is great and what a wonderful world we're living in. And I have no anxiety whatsoever. And I'm very comfortable with all the changes. Yeah. That's not really normal, or it's not necessary for your brain to be doing that. So to have these symptoms, to have this uncomfortability, that's very appropriate. If you're not able to self-manage it, if you're not able to take good care of yourself during those symptoms, that's probably when I'd recommend seeking out a trusted therapist, someone to sit down with, someone to brainstorm with, someone to say, here's what happened. Am I crazy? Absolutely not. Let's pull that situation apart. Let's identify why the symptoms happened, why this occurred, and figure out what we want to do. It's very similar when you call your doctor and you say, here are these symptoms. I don't know if it's a flu. I don't know if it's the virus. I don't know if it's strep throat. Okay, let's talk about it. Let's figure out what it could be and what's the best treatment. What's the best prescription here? And that's what a good therapist needs to do.
Respond to this thought real quick. To receive help and treatment for mental health is equivalent to a diabetic getting insulin.
Yeah. I mean, to go that far, I mean, it's not inappropriate to seek mental health treatment. It doesn't mean that there's something wrong with you for seeking out assistance to process what's going on internally. I don't always think of it as diabetes because, you have to have that insulin and whatnot, but I sometimes think of it as like more of a cold or a virus, or you get in a car accident. So you get in a car accident, you go to the ER. We have to go to the ER because you need a full workup because we don't know what happened to you in that car. So you go through some type of event in your personal life, and now you're having these odd symptoms weeks later. You would touch base with the therapist because I had this event happen. Now I'm having these symptoms happen. Is there some kind of connection? What's going on? Everybody just kind of panics first thinking the therapist is going to call me crazy. The therapist is going to tell me my worst fears. There is something horribly wrong with me. That's not going to come out of my mouth. And if it comes out of your therapist's mouth, you need a new therapist.
So, Katelynn, you mentioned a term earlier of self-manage. If you can't self-manage, I want Rhonda to chime in on this too, because we asked Dr. Dhat and he answered kind of how he self-regulates and takes care of himself, self-care. What does self-management, self-care, what are some tips for that? What does that look like for you personally? Because you're in a very heavy, high stress environment. And I want to ask Rhonda the same thing.
Yeah, so I love to walk. I love to walk. I love to run. I love to be just kind of, outside and get my thoughts kind of in order. I also love reading. I love just a nice good book just to calm down, a nice cup of coffee on the patio where there's no noise, there's no sound, you can just sit and just kind of relax for just a minute and take those deep breaths. I'm a big Netflix girl, so all my clients know that. We're always talking about who's on Netflix and who's on what. So when you can't take pleasure in some of those smaller type things, when you can't enjoy yourself, that's when I usually say, there could be something more going on. Because patients, who can't self-soothe, who can't self-regulate, and who can't do the self-care you're talking about, it's usually because there's something bigger going on and it's preventing you from relaxing. And like Dr. Dhat also said, you're not getting that oxygen. So now that you're not getting the oxygen, you're not taking good care of yourself. Now it's a ripple effect and so many more things are going on. And a supervisor told us, when is it a good time to seek out therapy? When is that a good idea? And it's when your traditional day-to-day life is becoming drastically impaired and you're not able to do the things that you would normally do or the things you would enjoy to do. And there's just this whole kind of dysregulation that's happening. So when I'm not taking good care of myself, when I didn't take that walk in the morning or read that book or take 30 minutes of yoga and just shut the door or 30 minutes of my Netflix, that's a problem. Something's going on with me and I need to think about that.
Yeah. Rhonda, what about you? What does self-manage look like and when do you kind of know?
I just want to say also, therapy is a gift that you give yourself. I just want to respond to that and put that out there for anyone who may be listening, may be struggling. Do I get help? Do I not get help? I just want you to know that you're giving yourself a gift and it is a good gift. Some of the things that I do and what I've been doing lately and since COVID-19 hit is I've been doing a lot of mindfulness. And so basically, I've been working with Grounded Path Holistic Counseling, Shimala Keenum, and doing some of her classes to really help keep me, to get my body, my mind, and my spirit kind of aligned and to really focus on the here and now in a very non-judgmental way, but just that awareness of what's going on with me now, to sit with those feelings that I may be feeling, and just taking those classes to help me, whether it's mindfulness walking, whether it's trying to, and I'm really working on mindfulness eating, but whether it's those types of things, I'm doing those classes have really helped balance me and it's really helped keep me calm. One of the things, I'm also an ordained minister. So one of the big parts of my life is prayer and meditation. That is something that I start my day off every day with, is just being prayerful and meditating. And that's something prior to COVID, we were all multitasking and on the go and no one was slowing down. So COVID-19 has forced me to slow down a little bit more and to be more prayerful and to be able to sit with myself for longer periods of time. And certainly, before that, and just, you don't stay in this field for 26 years and not have good self-care. You won't make it, you'll burn out. But I've done exercise, walking. I've taken classes at Yoga Goodness with Leslie Davis. I'm a novice when it comes to it, but those types of things are self-care for me. Spending time with positive people, my family, my friends, anything that's giving good energy. One of my biggest things that I've been doing is my gratitude journal. I believe in what I tell my clients to do, I do as well. And so just being grateful, because I'm going to tell you, I haven't been okay either, Christine, in these past weeks sometimes. So I needed to have an outlet to get it out. And I needed to refocus. It says, all these things are going on in the world, but hey, I'm still grateful for this. And when I can look at my list to see what's going good in my life, it helps me to get through. And I also just want to say, because I work for Horizon Behavioral Health, I have to do this. We have open access to, and we have, people can come in for mental and substance use services. Our number is 477-5000. And, I would be remiss if I did not mention that because,
Absolutely.
But I just want you to know that we have been continually providing telehealth therapy throughout this process, and you can receive help and you don't have to wait. You can just do walk-ins. And again, that number is 477-5000. And I also just want to encourage anybody who's listening, if anything, about where do I go if I have an addiction, please log on to the CVAR website, cvar.org, and take advantage of that resource, as well as COVID-19 resources is on that as well.
I just can't thank you all enough. I know I'll leave you with my one self-care or self-management tip that's helped me. Michael Hyatt, who's a leadership expert, he had a quote one time that has stuck with me. And he said, what he says to him in times of crisis or in times of a meltdown is, what does this crisis, what opportunity does this afford me? So when you're home and you can't go anywhere, you can either focus on, I'm stuck, I have no toilet paper, I have no way to get out, or what does this allow me to do? And boy, for those that are swamped and are overwhelmed the majority of their life, this does give you a chance to slow down and think about, dream about, journal about maybe some things you want to be different. So what does this opportunity afford you in the middle of this crisis? And I know even, we did a call on Tuesday about the current plight of equity in our country. And I love this, one of my dear friends said, this gives us an opportunity to do things differently. And if we don't take that opportunity, shame on us. And so I would tell everybody that feels like, oh my gosh, something's wrong with me. No, what's the opportunity in this for you so that you don't end up here again feeling like shame or whatever. Just a note in the chat box. Someone says, as someone who struggles with anxiety and depression, this hour was invaluable to me.
Wow.
Thank you all for taking the time to share. And I want to echo that. Couple other plugs, cvar.org. Remember that. I've posted that. Rhonda, I did mention that you're a published author. Your book is called Walking by Faith. So if that's something that you think would help you, if you're listening, please seek out Rhonda to get a copy of that book. I would also be remiss if I didn't mention, and this is probably on the CVAR website, but there is an employer resource. If you're an employer or an HR person on this phone call, All Points EAP is a confidential free counseling service you can offer to your employees. And sometimes if an employee knows that that's available to them and nobody will ever know, they may be more apt to take advantage of that resource. So you can look up All Points EAP. I don't have the website right in front of me, but I'll put that on the Leadership Lynchburg link. Thank you all for helping have this vital conversation in our community. And it's my hope that thousands of people will watch this and do what they need to do to get help, or they will do what they need to do as leaders to help their staff and their employees. So I wish you all great.
Christine, I wanted to end with one quote. I always have a quote. Winston Churchill said it best, and I definitely had to say this. The heart of the human problem is the problem of the human heart. So folks, I just want to leave you with keep taking care of your heart, because from your heart is the wellspring of life. And so thanks for being a part of this hour. And I loved this panelist. And again, Leadership Lynchburg for letting us do this. This was invaluable.
Take care, everyone.
Thank you.
Yes.
Thank you.
Be well, be healthy, and love on some people, because Lord knows we need it right now.
Yes.
Thank you.
Thank you all.
Thank
Thank
you.
you.